We know the best protection from COVID-19 is getting vaccinated, but it's natural for parents to have questions about giving their kids the jab. So I'm going to try to answer those questions for you.
I heard that COVID isn't bad in kids, so why do they need a vaccine?
COVID-19 is a serious illness that can affect everyone, including children. Vaccines can help stop your child becoming very sick or even dying if they catch the virus. Vaccines may also help protect against a serious inflammatory syndrome that can occur in a small number of children after they get COVID-19. Being vaccinated can also reduce the chances of passing the virus on to others, which helps protect the whole community.
Are vaccines safe for kids?
Rest assured, all vaccines that have been approved for use in children have been rigorously tested before being given the seal of approval. So they're fine for kids to get.
My grandchild's scared of needles. What advice could I give my daughter?
Healthcare workers are used to seeing kids who are scared of needles and can help to make it less scary for them. Often, the calmer you are, the more calm they'll be. It could help to bring a toy or a friend. Distracting them can go a long way.
And how many vaccinations do kids have to get?
Kids are smaller than adults, so they get a smaller dose of the vaccine. Like all of us, however, they need more than one vaccine dose to stay up to date and get the best immunity.
Is there any side effects I have to worry about for my son?
Like adults, kids might experience some mild side effects after their vaccine. Side effects are perfectly normal and are actually a sign that the vaccine is teaching your child's body how to fight the virus. The sorts of things you'd see after any vaccination can include fever, chills, headache and soreness where they've been injected. They don't happen to everyone and don't usually last too long.
My son's had COVID. Does he even need the vaccine?
Catching COVID-19 will give your child some immunity, but we're not sure how much or for how long, so it's important they still get vaccinated after they've recovered. This helps to further protect them for longer.
I've heard a lot of scary stories about the vaccination and I'm worried about my grandchildren.
Fake stories and misinformation are unfortunately very common, especially on social media. But even if you know they're not true, they can leave a scary picture in your mind. The safety of COVID-19 vaccinations continue to be monitored in Australia and around the world. If you're worried in any way, have questions, or just want to yarn about getting your kids vaccinated, talk to your local healthcare worker. You can also call the National Coronavirus Helpline on 1800 020 080. So help protect your kids, your family and your mob and get your kids vaccinated.